Remember last year, everyone freaking out about grocery prices?
Yeah.
It felt like every time you went to the store, you were emptying your wallet for like a loaf of bread and some milk.
Right.
Thankfully, things seem to have calmed down a bit on that front, but
What?
there's always a
Nice.
but, right?
Always.
It seems like while we were distracted by those crazy grocery bills, health insurance premiums, well, they decided now was their time to shine. Or, I guess, not shine, more like
We're like drain everyone's bank account.
exactly. They're just climbing higher and higher. So today, we are going deep, deep, deep into the why. Why is health insurance costing us so much? And to help us on this little journey, we have our expert back with us again.
Hi. Glad to be back.
And we're diving in using this USA Today article. Oh, let me check the date. October 9th, I think.
Just last week, yeah.
Yeah, just last week. And let me tell you, this article does not sugarcoat it. Like right away, bam, first paragraph, we've got this stat about family health insurance plans. The ones you get through work,
Yeah.
those went up 7% this year. 7%.
And what they don't mention right away is that that's on top of the 7% increase we saw last year, too.
Oh, no. Are you serious?
Yep. So 2 years in a row with that kind of jump. We're talking an average of $25,572 per year for a family plan now.
Ouch. That's a big chunk of change.
Yeah, and to put that in perspective, before these last 2 years, premiums were increasing much, much slower. For like a decade.
So it's not just me. It's not like when you get older and suddenly think everything was cheaper when you were a kid.
There's a real trend.
This is real. Okay, so it's not just families taking the hit. Individual plans went up too, right?
Oh, yeah, definitely. 6% this year, so now the average is something like $8,951 annually for an individual.
See, that number always sounds smaller, but
But you're right, it's all on you. No employer help with that. So when you consider rent and all the other bills,
student loans,
right, student loans, that's a lot to handle.
it's a lot. So why? Why is this happening?
Yeah.
The article threw out a few ideas, and this one really caught my eye, this whole thing about healthcare costs lagging behind overall inflation.
Yeah, that's a good one. Most people don't really connect those two things.
I don't think I do, really.
Mm-hmm.
Explain it to me like I'm 5.
Okay, so you know how, like, with gas prices, the price goes up pretty much immediately when something happens, like when there's a war or whatever.
Right.
Healthcare costs are not like that. They're slower.
Like more of a tortoise than a hare.
Exactly. So basically, we're just now feeling the effects of, well, everything.
Ugh.
Everything that's happened the last few years. Inflation's cooling off now, but healthcare costs are just catching up, so to speak.
So we're all just getting whiplash, basically. Just when we thought things were getting better, bam, healthcare's like, nope.
Pretty much. And then there's the other thing, the thing no one wants to talk about anymore.
The P word.
The one and only. The pandemic.
Right. Because for a while there, it felt like nobody was going to the doctor unless they were, like, on fire.
Well, yeah, we were all basically told to stay home unless it was a dire emergency. Put off those routine checkups. Skip the dentist.
Oh, I definitely did not miss going to the dentist, let me tell you.
I think we all did our fair share of that, right? But the thing is, things are, back to normal now, more or less, so.
So everyone's playing catch up.
Right. All those appointments, procedures, people skipped, they're happening now, and that puts a strain on the whole system.
Because suddenly everyone needs to see a doctor.
Exactly. More demand equals higher prices. That's just basic economics, right? And those higher prices, yeah, they trickle down to our lovely insurance premiums. It's like everybody suddenly decided to go to the doctor all at once.
It's giving very much FOMO, fear of missing out vibes, but for, like, healthcare.
Right. Like, oh, I better get in there before the prices go up even more.
Okay, so we've got all these factors pushing prices up, but who's actually paying? I mean, obviously we are, right? It's coming out of our paychecks one way or another. But the article broke down exactly who pays how much, and I was shocked. Employers are actually paying a lot more than I would have guessed.
Way more. I think most people would be surprised. For that average family plan we were talking about, the $25,000 one,
Yeah.
employers are paying like $19,000 of that.
No way. So what, employees are just on the hook for like $6,000?
$6,000-ish, yeah, usually taken right out of their paychecks.
Wow, I had no idea. But I guess it makes sense, right? Like offering good health insurance is a big selling point for companies these days.
Totally. It's a huge part of attracting and keeping good employees, especially right now. But it does put companies in a tough spot, right?
Yeah, I mean, that's a big expense for them to handle every year.
And then employees are getting squeezed because those costs have to come from somewhere. either from higher premiums or lower wages.
It's like a lose-lose situation, really.
It's tough all around. Okay, so speaking of tough situations, the article also went into this whole thing about narrow networks. And I'll be honest, I don't totally get it.
Narrow networks. Yeah, that's one of those healthcare terms that always sounds kind of scary, like you're about to get trapped in a tiny little box with limited options.
That's a pretty good analogy, actually.
So what is it?
Basically, it's when your insurance plan only covers you if you go to certain doctors or hospitals.
So like you can only go to the grocery store down the street, even if it doesn't have the best prices, because that's the one in your network.
Yeah, that's the idea. They are trying to limit your choices to keep costs down.
But what if you need like a specialist? And the one covered by your plan is a total quack.
Well, that's the trade-off, right? You might save money on your monthly premiums, but you lose some freedom.
It's like those discount airlines. Sure, the flight is cheap, but you better pack light and don't even think about asking for a glass of water.
Right. It's all about weighing your options. Are lower monthly costs worth the potential inconvenience or risk of not getting the exact care you want?
Tough call. And the article mentioned that this is a big problem for small businesses, right?
Huge problem. They just don't have the same power as bigger companies when negotiating with insurance companies.
So they're kind of stuck with whatever they can get.
Yeah, and the article actually gave this example of this business in South Carolina, Epting Distributors.
Okay, what happened to them?
Their healthcare costs went up by almost 30% this year.
30%. Oh my gosh, that's insane.
It's brutal. And the article said they were really frustrated with how, nobody could tell them how much anything actually costs.
Yeah, the whole lack of transparency thing.
Right, good luck trying to figure out what a procedure will cost ahead of time. It's like the healthcare industry wants to keep us all in the dark.
It's true. You'd think in this day and age we'd be able to compare prices for healthcare just like we can for everything else.
You would think, right. But nope. It's so frustrating. Okay, but hold on. Before we completely lose all hope, we have to talk about this other wrinkle that the article mentioned. These new weight loss drugs that are all the rage right now. These aren't like your friend's fad diet pills.
Right, yeah. These are serious medications.
And they come with some serious price tags.
Yeah, they do. We're talking about drugs like Ozempic and Wegovy. People are seeing amazing results with them, like really significant weight loss.
Right.
But they can cost you over $10,000 a year.
Wait, seriously? For weight loss drugs?
Yeah.
Wow. That's a lot, more than my car payment.
Okay, so are insurance companies even covering this? Or are they running for the hills?
A lot of them are still trying to figure that out, honestly.
Yeah.
It's a big decision, right? Because if they start covering these drugs for everyone who wants them,
There goes the budget.
pretty much. Plus, it's still early, We don't have a lot of long-term data on these drugs yet, so it's hard to say what the cost-benefit analysis will look like a few years down the road.
Yeah, it's a tough one. So where does that leave us? It seems like we're, stuck between a rock and a hard place.
It's definitely a tricky situation, but that's why it's so important to, stay informed, understand what's driving these costs.
Right, like all the things we've been talking about.
Exactly. And don't be afraid to ask questions.
Ask questions like what?
When you get those health insurance options during open enrollment,
Oh yeah, that's coming up.
right, don't just blindly pick the cheapest one or whatever you had last year. Really dig into those plans, see what's covered, what's not.
Compare prices.
Yes. And don't be afraid to call the insurance company and be like, hey, explain this to me.
Why is this so expensive?
Right. You have more power than you think you do.
I like that. Knowledge is power. Okay, so to wrap this all up, it seems like the cost of healthcare is a big, hairy mess, but we can do things to protect ourselves.
Absolutely. Don't just be a passive bystander in this whole thing. Get informed, ask questions, and make your voice heard.
Love it. Well, that's all the time we have for today's deep dive into, the wild world of health insurance costs. As always, thanks for joining us.
Thanks for having me.
And remember, stay curious out there.